are hosted by Dentists in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We are pulling back the curtain on the industry. We're talking to the experts, the educators, the innovators, and we're talking to the everyday clinicians who are out there doing the work. There's no fluff, there's no filter, and there's definitely no sales pitches that are disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the goods. So it doesn't matter if you're a seasoned doc or, for that matter, anyone in the dental industry. Maybe you're a curious consumer. Maybe you're just here for the banter. We welcome you all to the show because around here, we're not just in the loop, we are in the know. Hey everyone, I'm Dr. Jeff Horowitz, and I am accompanied on this humble little platform by two of my best friends in the entire world. I am now part of several universes that exist. So, of all the worlds I know, this is one of them. Anyway, I am here with my great friends, Dr. Chad Duplantis and Dr. Jennifer Bell, two great educators and business owners and practitioners. So, the three of us together have developed this humble little platform to make the dental world a little smaller, but a lot more fun. And tonight, it's going to be both of those things. We have a terrific show. We have an amazing hygienist, an amazing speaker. We had the pleasure of listening to her when we were down in Cabo for Ada Aspire. She did a wonderful keynote presentation. She is also known as the dental WINEgenist because she also happens to be a sommelier. I mean, I can't say enough things about this woman tonight. We're going to get smarter about the oral systemic connection. And I'm just excited about it all. So, how's it going, my friends? It's good to see you.
It's great to be seen.
Which
Thanks
worlds did you come from tonight, Chad?
Are you on the Elon Musk experimental Mars community, or is that where you're headed?
It's a possibility. I am trying to find the funds to fund that journey, but I would love to do that.
Well, you know, the older we get, the less it would matter if it didn't work out.
Exactly.
Yeah.
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 That's
Could be
very
Which at least a
inconsequential.
few won't. I mean, the pilgrims, there's been many explorers who had many stories, and a percentage of them did work out always, but there are many that
percentage
did
of
not.
them did not.
Yeah.
Yeah, many.
Percentage
But they
of them.
were only going to live, I mean, they were kind of at the end of their journey because most of them are only going to live to 30 or maybe 40 at
That's
best
true.
anyway.
That's true.
So, it's all relative.
Sure. Isn't
Yeah.
it?
So I had a crazy week. I'm going to start the banter.
Let's go.
Has anyone out there, and I'm asking this for everybody who listens, anybody who owns a business, doesn't even have to be dentistry. Has anyone ever had to let go an entire department within their practice? Because in over 30, you did. Well, you mentioned that back to me, but I never got the full story on it. I know it was in your satellite practice. In 30 something years of practice, now going on 34, for the first time recently, I had to do that. And boy, that's not a pleasant experience. It
No.
takes, there's a whole lot of moving parts, but that kind of made for a stressful week. So I'm curious what your experience was with that, Jennifer.
Oh, it's very stressful.
Yeah.
The majority of them chose to leave on their own accord, but it just had sort of hit ahead. So I don't want to speak on why they did or didn't work out there. But what it does create is a tremendous vacuum space of needing to fill roles very quickly. And usually, what you're going to find, Jeff, that's really difficult in this transition is usually you have at least one existing team member who can take on responsibilities of training new team members to come in and be ready to take on that job. When you've taken an entire department away and you want to refill that department with new people, no one in that department anymore knows how to do the job the way that you would like them to do it in your field. So then you're very dependent on other team members and other departments to step up and be available to help in that transition. And you now play a much larger role in the training
Absolutely.
and
That was my
you know,
Monday, was me playing a much larger role
yeah.
than I have for some time. And it's a good thing. I've been kind of trying to get more involved in this practice anyway. But you know, everyone knows I have the two separate practices, and I split my time between them, and it's hard to be present when you're doing a lot of things. It's hard to be fully present at all, and admittedly, I need to do a better job of that. But it's kind of forced me to do so, and in a good way. The only person that we have left over in that department was a trainee who just has the most wonderful attitude. And I was like, yeah, you know, it was, the whole thing was bad, but I'm like, I'm not gonna let go of somebody who has come in, you know, shown that they really want to be a part of the team, that they really want to learn this trade. Um, but the problem was, had she stayed much longer with the people that were there, I feel like she would have gone in the wrong direction. And again, I'm not going to get into any of what happened or any of that, but it was definitely a situation where her experience in learning and as a team member would not have been the same had she kept training under the rest of that group.
Well, at the end of the day, no one needs to be in a job or own a practice in an environment where it doesn't feel good to be there every day and that everyone's working together as a team. And I've said this many times on our show, but we all have evolutions in our life and we all have changes that happen in, I mean, think about the type of dentist you were when you graduated from dental school to the type of dentist you were when you started doing ortho, the type of dentist you were when you were growing practices. Like, we evolve over time. Sometimes team members are meant to sustain that particular type of journey, and sometimes they're not meant to
Right.
sustain that they're just not the right people for the bus anymore. It's not a bad thing or a good thing. It's just the evolution of a profession. And very few people take a job right out of anything, high school, college, a profession, trade, whatever, and it's the one job that they have for the rest like the one employment that they have for the rest of their life, because they, as employees, also evolve in demand and want things to be different or
Yeah.
whatever. So the lesson here, I think, is that for doctors to feel empowered to, if you have cancer in your practice, it has to go and it needs to be sort of worked out. But secondly, don't feel bad if you're honestly even letting go of really good people, if it's just not the right people to be on the bus for that next phase of the journey. You just need people who are willing to learn and grow and have, like Katrina said, a strong, positive attitude to see they're excited about your journey and want to be a part of it, and not a resistance to
Yeah.
that
And
evolution.
what's really interesting in all of it was, of course, everybody is sad right when that happens.
Yep.
And everyone's concern, and culture is just such an important thing within any practice. You can, you know, you can go in and feel the temperature, you know, in a
Yep.
practice where things are not going well, and know it right away. It's palpable. But the interesting thing was that everyone was really complaining about high stress levels. And this situation made everybody have to work a little harder this week, but everybody was so happy and didn't feel the same amount of stress, even though they were having to work harder.
Yeah.
So hopefully that's a good message. Chad, have you ever, even if it was, have you ever had to let like more than one person go at the same time, even if it wasn't the same department?
Is this thing working?
Yeah, yeah. You're
Is
allowed
it-
to speak now, Chad.
Oh, okay, thanks.
Yeah.
I have no recollection of that.
Okay. So much for Chad.
Well, okay then.
I I have not had to let an entire department go.
Yeah.
Thank you.
Yeah. And why are you getting so close to your mic now?
Because it felt like I wasn't here for the first 12 minutes of this presentation.
You're
So
acting
now
like
that
this
I'm
is the
here.
Spanish Inquisition.
Yeah.
Yeah.
I mean,
No, I have not. I have not had
we're
to,
speaking before
fortunately,
Congress.
and it's not sitting here saying that my practice is perfect. I'm just actually chiming in and listening. So I'm
Okay.
listening.
All right.
Yeah.
Well,
How
thanks.
was your week then, Chad?
On another note,
Did it
Well,
get better? Okay, as a quick recap, last week, Chad was sad. Chad was sad and feeling a little beat up from the day. Um, sometimes we're the windshield, sometimes we're the bug. I think he was feeling like both a little bit.
yeah, I think this week is on a little bit of a more upward trajectory.
Okay. All right.
I did lose a little bit of my sanity last night. I was introduced at home to a show called Love Island. Has
oh
anybody
yeah,
heard
Oh
of that?
Lord.
Yeah. Yeah, I got to enjoy that with a couple of college-aged adults, and
Okay.
I could not excuse myself to go to bed at my usual bedtime. I don't know that I will waste any more of my time watching that show, but that's
Okay.
about the highlight of my week. That was interesting. I didn't realize people live like
Wow.
that. Yeah.
yeah.
Wow.
It's easy to get caught up in that kind of stuff, though.
That's
Yeah,
the
it's
highlight.
not. I'm glad it's on right now, and I don't have to be in there watching it again.
Yeah. Yeah.
Okay,
And I'm
fair.
glad we have other TVs in the house.
Yeah. I mean, full admission, there was a time where I was full on stuck on The Bachelorette.
Oh,
Like
I know. He
there
used to
and
text me
hey,
about it.
we used to talk about it. I was
Yeah.
like, it's a train wreck, but I can't stop watching.
That was its
Back in the
heyday,
day.
though.
Back in the
Back
day,
in the
yeah,
day.
yeah.
Back in the day, yeah. But I mean, hell, when I was their age, I was probably watching that crap too. But it's
No,
just
you
I'm too old
weren't.
for it now.
No, you
No, I
weren't.
was. I was. I think there was one
There
called
wasn't reality TV when you were a teenager. It was
No.
Flintstones.
She's well in her 20s. When I started in my practice, my office manager and I used to
Well,
come in and talk about there was a show called Hotel Paradise or Paradise Hotel or something, and it was very similar to Love Island. And I mean, we were hooked on that. But nowadays, I'm like, I can't handle this, man.
I do not remember that
No.
show.
Yeah.
Well, JB, as the organized person in this group, I would like for you to make a note that we need to work on a children's book. And I can have Luke do a sketch of Chad as he looks right now with the blue glasses, and we're just going to make a children's book called Chad is Sad.
That's right. Yeah. Yeah. Yeah.
I have
Yeah.
to figure out how to end it with Chad is glad.
Yeah.
Yeah.
Yeah. Well, hey, it still rhymes. So
And
I
mad.
think, yeah, it's working.
Actually, Chad, your name is very helpful.
Hey, we've got a guest waiting. Let's
I
get to
know.
the
Let's
news.
go.
Let's get our guest on.
Sorry.
Enough brainstorming.
Austin, take us away.
Oh gosh, now he wants to do the news. Fine. All right, team. A couple of updates from last week, and we'll get into some news stories. So, remember last week we talked about HB 1033, a lot of activity on
Hey, JB, just going to stop you right now. Sorry. I refreshed and obviously I popped up on the screen, but we have no audio on you. We have no audio. So,
Okay, well, let's just start over then and we'll edit that out.
okay, there we go. Austin, take me away, please.
Okay, team. Last week we talked about HB 1033. A ton of you had questions. That is North Carolina's dental board reform bill, and specifically how dentists might lose the right to elect their own members. A lot of you had feelings about that, and I love it. Well, this week we're going to dig a little bit deeper into that bill, and I want to talk to you about a provision that sounds alarming on the surface, but once you understand where it comes from, it might actually make a little bit more sense. The bill includes language, and this caught me very much off guard. It includes language that says the dental board cannot order an unlicensed person to stop practicing dentistry. Only a court can do that. And if you've been a fan of the show for long enough, you know I've reported time and time again about another foreign trained dentist performing dental services, or maybe not even a foreign trained dentist, just a rando person in their garage making dentures, taking teeth out, and doing dentistry and charging people money. And then ultimately the people get hurt and they go file complaints with their dental board and file lawsuits against the unlicensed practitioner. Now, in an ideal world, you would want the dental board to go in and shut that person down. Now, I need you to understand that it's not this reform bill that may be the issue. Now, before you close us down, here's what you need to know. That restriction already exists. It's been the law of the land since 2015 when the U.S. Supreme Court ruled against the North Carolina Dental Board in a case that started with mall teeth whitening kiosks. And I was there for it all. But here's the part that should make every dentist angry. The board was trying to protect the patients, as I'm sure you know. Dentists were seeing people walking in with chemical burns and gum damage from these unlicensed operators. When they went to cease and desist them, they got sued for antitrust violations. Now, the court said the problem wasn't what the board did, it was who was sitting on the board. Too many active dentists, not enough state oversight. So, HB 1033 is the legislature's answer to that ruling a decade later. Whether it actually solves the real problem, that's a different conversation. And it doesn't really dig into how North Carolina Dental Board, or any dental board, because this applies to all 50 dental boards, how they protect the public by shutting down unlicensed operators while they're in violation of this antitrust law of the land in that ruling in 2015. This has to be worked out. Dental boards should be able to go in and shut down unlicensed dentists immediately and allow that to be worked out in the court, as opposed to how it currently operates because it's of an antitrust competitive landscape. They are not allowed to shut down an unlicensed dentist if the dental board is made mostly of dentists, which most of them are. They can't shut it down because of competition. They have to wait for the court to file an injunction to go and shut the individual down. Meanwhile, they continue practicing dentistry. Lots to uncover in this HB 1033 and lots of debate. I would love your comments in the comment section so we can dive into that a little bit deeper. All right, story number 2. If you've been frustrated watching that hygiene schedule go unfilled for months, well, Virginia is trying to solve that problem. We have story after story after story on workforce issues here on the podcast. And Virginia, as are many other states, are bringing forth some unique answers. Governor Spanberger signed 2 workforce bills last month that take effect July 1st, only 3 weeks away. Here's what changes. First, internationally trained dentists can now pursue dental hygiene licensure in Virginia. They have to pass the National Board Hygiene exam and complete a clinical assessment. But if they do, they can start treating patients in a preventative capacity. The ADA called it a responsible pathway for providers who were previously sitting on the sidelines. The second part was qualified dental assistants can now perform supragingival scaling and coronal polishing under dental supervision. Other states and federal systems have been operating with these revised laws for a while. So Virginia was paying attention and decided that this would help them offset a dental hygiene workforce issue. Not an opinion. Would love your comments in the section below. Let us know how you feel about moving into expanded function with dental assistants. The Virginia Dental Association was in support of both bills to help resolve issues they were currently identifying in rural and underserved areas. Another state, Illinois, made a quiet change on Jan 1, trying to also solve a hiring gap. This one's kind of interesting, and I kind of like this story. You know the scenario. A new graduate finishes dental school, passes their boards, submits their license application, sits in limbo for weeks or months waiting for approval while there's an open chair, maybe with their future practice, and their student loans are starting to amass. Well, Illinois decided to stop that practice. As of this year, dental graduates who have completed their education, passed their exams, and submitted a proper application can now practice under supervision while they wait. The supervising dentist is responsible for oversight, and that supervision has to be real and documented. but a pathway for dentists to get to work and start earning an income while they're waiting for the documentation. So I think that's an interesting alternative, and the first I've seen of that particular nuance of moving forward. Now I bring this story up because of our guest tonight, so I hope we can dig into this a little bit. Let's talk about a number. 91%. This was an American Dental Hygiene Association study that just came out in April, reporting that 91% of dentists are actively trying to hire a dental hygienist, and they describe the search as very or extremely challenging. 78% of all practices have at least one unfilled position right now. We haven't solved the workforce issue. There are a few things that seem promising. The pipeline does seem to be opening up a little bit. Hygiene school enrollment was up 16% since 2020, and last year had the most graduates ever. That's progress. But we know that the gap between the number of dental hygiene students that are graduating and the number of dentists that are graduating is pretty significant. So we would have to see an exponential leap and dental hygienists entering the marketplace to start to close the gap. I'm going to love to hear Katrina's opinion on this, because I think we as dentists have to be working very closely with our Dental Hygiene Association and our dental hygienists in particular to solve this problem collectively as a profession, because too many are just waiting to solve it for us. And with that, that's the news.
My AI camera decided to
I
go
was
away.
going to say, did you go to the bathroom?
No, I did not. I don't know why it went away from me. I was like, I had to refresh, and that might have been it, because we lost your audio and I thought it was me. So, damn it. Come back. Now we go. There we go.
Well, I'm
now,
glad y'all told me.
yeah, sorry
Now
about
we
that.
lost Jeff's audio.
Is
Son of a biscuit.
Jeff lost his audio again?
Yeah.
Okay, while he's muting and unmuting, how about I introduce our guest?
Let's do it.
Okay. So, our guest is a truly wonderful human being. I met her several years ago. Her name is Katrina Sanders. I think the least of all that she does, which is really pretty powerful too, is that she's a very high-powered hygienist from the Arizona area.
Aereo?
Aereo, yeah. Well, I was about to say that she was part of AZPerio from the Arizona Aereo. You know what I'm saying? I was going to make a little rhyme, But let's look at some of the accolades. She's a sommelier.
Mm-hmm.
So she is lovingly known as the dental WINEgenist.
Mm-hmm.
She's a redhead, so you know that she's pretty feisty. All right, so we'll go ahead and throw that out there. She is I don't know what you really call this, but she is a mountaineer, an alpinist, a trekker. She climbed Mount Kilimanjaro. I mean, there's several names for it, but we'll just call her a mountaineer. I mean, she's not from West Virginia, but she did do some pretty badass mountain climbing in Africa and shit. I mean, like real intense stuff. But most importantly, she's a friend to many in the industry. A lot of people know her, love her. She keynotes a lot of conferences. She writes a lot of articles. She does a lot for the profession of dentistry. But as I always say, that's not her most important job, because her second most important job is she's a wife. Her first most important job is she's a mom to a 6-month-old. And she's just an awesome human being. So we're honored to have you here, Katrina. And I hope I did that justice, because I'll be damned if I'm going to read another bio again. I'm done.
That was amazing.
Oh, you gave up on bios? That just happened right now?
Dude, I have.
I love it.
Because it's too complicated to try and read it and be like,
I know.
oh, she was on the board at the University of Minnesota and got some freaking award. I mean, who cares?
Who really cares? Seriously. I just say,
by the way, she did get an award.
I have a kid and I drink wine.
Big deal.
Well, thank you all so much for having me. I'm so happy to be here. Happy Wine Down Wednesday, friends.
Wine Down Wednesday.
Happy hour.
Yes, it is happy hour. Yes.
Well,
cheers.
We are really glad to have you here. So tell us about your day.
Oh my gosh. Well, I was getting a little bit triggered hearing about the firing of an entire department earlier during your banter. Because although I don't own a dental practice myself, I do own several businesses. And as somebody who speaks and consults, I have a gamut of team members who help to run a lot of the administrative things behind the scenes. And I, right away when I came back from maternity leave, literally like wiped out an entire department. Which for me is two people, but two full-time people that I literally wiped out. I just was like, you're done. You're fired. And I just like got rid of them. And so I felt that like weight just 20 minutes ago, talking about all of the fears of what happens when you let go of team members. And I'm still kind of in that space. We've since hired back one team member, but we're kind of experiencing this interesting dynamic in my business currently. If we're like kind of doing a little bit of a behind the kimono, I think some people like to see like what stuff happens behind the scenes,
Yeah.
right? So we have one team member who's really terrific. We've hired her on, and she, of course, as you can imagine, has been hired on to like a complete shit show of just like stuff. Nothing is correct. There are things all over the place, and everybody's hair is on fire. But I will say, you had mentioned it earlier, Dr. Bell, when you said like, hey, when you cut out the cancer, like there's just such a relief. And so today was actually really cool because although we ended up having to fix a lot of the things that team members should have been taken care of, it was very cathartic. And as a dental hygienist, like it was like the proverbial like doing a full mouth debridement, but like in my business.
Yeah.
You know what
yeah,
I mean?
Yeah.
So it felt really good. Felt good. And now I'm hanging out with you guys. So I mean, life is cool.
Good day.
It's cool.
I
don't know.
I didn't get to say this earlier, but you're talking about it. So I've never let go of an entire department, but I have let go of individuals on numerous occasions. And I also can say that I am the victim of bad hires as well.
Yeah, me too.
And one time, I'd heard from somebody, hey, you find somebody that's in the service industry, and they do a great job. They'll work great in a dental office. So, man, we're at the golf course.
Starbucks, you're doing
Yeah.
it.
Yeah, beverage cart attendant was awesome. I was like, hey, you want to come work for me?
Yeah.
So we hire this person, right? So she comes in, and like there were a couple of triggers, like the first few weeks that just really weren't working out in our environment. And so finally I was just like, all right, we just got to get rid of this. I made a bad decision. It's over. Let's get rid of this person. So we let them go, and they left. So anyhow, after they left their notebook at the front desk. So what the hell are you going to do?
You're going to open it and you're going to sift through
Damn
that.
right you
That's the
are.
tea. Yes.
Expecting like what happens, scripts when patient walks in. Oh no, we open this thing. It was like, this is the first page. Get up. Put cereal in bowl.
Oh,
shower.
it was a to-do list.
Add milk to, and I was like, holy crap. If we have to remember to shower, go to the bathroom, put cereal in the bowl, we got major problems that are way deeper than here. So I really kind of felt bad. But, all I can say to everything that everybody said is that it's very hard sometimes. It's very easy sometimes to let somebody go. And we know that's going to be okay. But sometimes it's very hard to let somebody go as well. And in the end, if we're a good leader, it's going to be okay.
Yeah.
We're going to be just fine. And in most instances, we're going to be better than we were before.
I think that's a beautiful sentiment. And I would take it one step further because for folks who are joining us live or watching this in post who follow me, my husband runs like the business side of things. He's my COO. Which means I'm the boss, by the way. He's my COO. And he and I have a lot of like postmortems after we fire somebody. And I am a lot more cutthroat. My husband's a little bit more like, I don't know, maybe we should give them another 90 days to completely screw up our business. And then maybe we'll decide if we want to. And I'm like, get rid of them. So now we've started to kind of go down this rabbit hole of like the number of time, like, did we ever regret letting someone go and knowing what we know about that person, like I go into their inbox and I see like their notebook of stuff, right? And you're like, so you never opened this email where we told you you needed to do this, or you like there were 4 days you logged in and we paid you, but you didn't send a single email. Like that's weird. And so we have that like postmortem thing of like, oh, maybe we didn't fire them soon enough. And I think this is a really important transition into what was talked about in the news earlier about the hygiene shortage and just that like overwhelm and fatigue that I can only imagine a dental practice owner, dentist has in hiring, bringing on, training, assimilating into the team culture, a dental hygienist and or hygiene department, right? And I recognize as a dental hygienist that we are very particular people. We are type A. Oftentimes, not always, but oftentimes, we're like, what are those like Siamese fighting fish? Like you don't want to put too many in a tank together.
Betas.
You know what I'm saying?
Oh
You
yeah,
know,
the beta fish.
the beta fish. Yeah.
Yeah.
You know what
And you
I'm
don't want
saying?
to
Where
put a
you're like,
mirror in front of them either.
no, you can't put a mirror. No, yeah, exactly. Can't do that.
Oh, that's true.
You can't do that because they'll fight with themselves,
Yeah.
which it's like a hygienist too. I mean, I get it. We're an interesting breed, and it has to be hard trying to bring somebody in who is the right fit, assimilates to the culture, and you get patients who fall in love with this hygienist, right? And it makes it even harder, I think, when you recognize like, oh, maybe it's time to let this hygienist go on to greener pastures elsewhere, that it's going to impact the success of your practice. It's going to impact the ability for hygiene patients to get through their hygiene recare system. It's going to impact, I mean, oftentimes it impacts your restorative column, right? Because your recare patients are the ones that oftentimes build that restorative column. And then you've got to explain to patients like, oh, yeah, I know you loved Susan so much. Wasn't she an amazing? Yeah, she's no longer here.
Right.
Yeah,
So I get it. It's hard.
that is.
And I think now, especially with this like perceived concept of the hygienist shortage, I fear that doctors are in a position where they're going to hire anybody who has two hands and a hygiene license and willing to work Tuesday, Wednesday, Thursday from 9 a.m. to 4 p.m. and maybe take out the garbage at the end of the day. And maybe we're not as focused like in years prior, where you could have a few more qualifying questions that you could ask a hygienist before you'd hire he or she into the department. Am I kind of surmising that right? Do you feel that from your
No,
colleagues?
you're absolutely right. I mean, the hygiene shortage has forced us to do a lot of things that we were. By the way, the hand signals are because we still don't have Jeff's audio. We love you, Jeff, but you know
Yeah.
what?
Yeah.
Sometimes it's damn nice that you can't talk. So, but no, the hygiene shortage has
Ooh.
forced us to do a couple of things that maybe we shouldn't do. But you're right. It is very, very hard when somebody has, people are very particular about which hygienist they see.
Yeah.
I want to see so and so. I want to see so and so. I want to see so and so. And when so and so's gone,
Yeah.
well, you better have a damn good answer as to why so and so's gone. Because you might not see that patient again because a lot of times they're not there for me or JB or Jeff. They're there for that hygienist. And I learned that when I switched practices too, is that, I had patients that came to me and they were like, hey, our family had a meeting over dinner. And we were like, are we following Dr. Duplantis or are we sticking with Joni? And I'm like,
Wow.
wow, okay, cool.
Yeah.
So it's very, very different. So,
Katrina,
and
I think
it's even more different.
you absolutely hit the nail on the head because it's still it's our gateway into the practice. Like if we aren't seeing hygiene patients on a regular frequency and taking care of them, if you only look at it from a revenue generating perspective, if they're not coming through the funnel, the practice has no sustainability long term. And so uh, to me, I think you're spot on that if you open a position tomorrow, maybe I'll get one applicant over a 3-month period or something like that. And And then it's just a salary negotiation. Like it's
Yeah.
not even a cultural negotiation. It's not a philosophy of care negotiation. It's really just a salary negotiation because they could go to 3 or 4 other practices tomorrow and make, you know, whatever it is that they desire that they need. And I don't know how you feel. I would love to get your opinion because I've also seen too that new grads that are coming in, and look, we've all been new grads and been woefully ill qualified for the jobs that we were hired for. But our salary was fairly in line with our lack of qualification. And I've also had challenges where new grads are coming in wanting to receive salaries that are much more in line with an experienced hygienist. And then, you know, we realized very quickly through the onboarding process that we need to reteach diagnostic processes and intervention strategies and how to use the technology we have in our office and things that I'm perfectly content doing. But from a production standpoint, it really starts to just come down to a P&L that you're looking at going, the scale is off.
Yeah. You know, can I get provocative here?
Yeah, you can say things and not agree with me.
Well,
Like you don't.
this isn't that kind of
Okay.
show.
I'm
I'm
getting
just
Yeah.
letting you know.
Wait, are you going to unbutton your shirt?
Yeah.
I'm getting, well, maybe. I don't
I'm
know.
kidding.
I'm
I'm
warm in
kidding.
here.
Yeah.
Kind of warm.
Put it out there.
Okay. So I'm gonna put it out there because Chad's actually taking his top off. Okay.
Yeah.
So here's the thing. Delta Dental, Blue Cross Blue Shield, they will pay the same fee for a pro fee for bite wings and an exam, regardless of if that hygienist has been practicing for 35 years or
100%.
35 minutes, period. So from a production standpoint, if we just level set and we say this person is doing all of the things that they should be doing, they are taking the correct imaging, they are diagnosing appropriately. And actually, if we could take it a step further, because I just used the D word, I just said they're diagnosing properly,
Which
and
they
can't do. This is what
Right.
blows my mind. I am legally licensed to treat a disease that I cannot legally diagnose. I can treat
Use
it,
the
I
other
can't
D word.
diagnose it.
You can draw damn good attention to it.
Damn, I sure can. That is true. And I think the co-diagnosis piece is really important. But the reality is, when we talk about the value of what a hygienist brings to a practice, I think we have to lay it all out on the table because this has been a massive pendulum. And this is
Yeah.
what really is so interesting. When I first graduated from hygiene school, I graduated in 2007. Entered the workforce right as like a huge economic recession happened. And the value of what I brought was do the bread and butter, bare minimum, keep these recare patients moving. And throughout my career, I have heard things like the hygiene department is a loss leader. I've heard things like, well, we know that we're going to pay a hygienist and all of this overhead, and we're not making that on the back end. There are consulting firms called No More Hygiene that literally talks about the fact that a practice is better, it's more successful, it's more effective if a hygienist or hygiene department is not a part of the critical care piece. And so, unfortunately, what has happened over at least the almost 20 years of my career time is I graduated at a time when my instructors at the University of Minnesota School of Dentistry told
Where
me,
you got
oh my
an
gosh.
award.
Thank you. I actually did get an award. I went back, I accepted the Distinguished Alumni Award, which was actually like a huge honor. It was absolutely amazing. And all my instructors were in the back of the room. And I was the student who couldn't figure out how to work the dental chair on day one of pre-clinic. So I'm sure they were completely shocked that I walked away with this Distinguished Alumni Award. But the idea being, I was told at the time, like, Katrina, you were entering this like amazing profession, and we work alongside our doctors and our doctors respect us. And when we need new equipment, our doctors respect and appreciate that. We are stakeholders in the practice. So doctor takes me to the CE coursework. When doctor goes to, LVI, Spear, Dentsply, Throne of World, like whatever it is, like, I go with, I'm a part of that conversation. Like that's what I graduated into, but that was not what I experienced when I graduated. It seemed like there was a very dynamic shift that occurred where what I saw, and this is, I'm just speaking from not only
Your
my
experience,
experience, but that of a lot of my contemporaries, where we were begging for new instruments, ultrasonic inserts that were like well past their prime, that needed to be retired. We were expected to use, just figure it out and do it. I would go to CE coursework. I would pay for my own CE. I would go to a CE course. I would come back after that CE course and I'd say, I learned this, that, this, and that. I would like to implement this in the practice. And I was told, like, that's really cute. No, this is the way we've always done it. Oh my gosh, the number of times I was told that over and over and over again, essentially like, shut up and do the prophy that you've been hired to do. But here's the reality. I graduated from hygiene school, and right out the gate, I, as a dental hygienist, knew what perio looked like. I knew how to at least support my doctor in diagnosing that. I knew how to come up with what's called a dental hygiene diagnosis, which means this means nothing unless a doctor signs off on it, but it is my surmise of what the assessments mean and putting a diagnosis that I think makes sense for this patient. The irony in this, you let me get provocative here, so I'm just going to take it a step further. The irony is, when I was in hygiene school, I took perio coursework alongside dental students. We were literally in the same lectures. We were on two different curves because the dental hygiene students were set to a higher curve when it came to periodontics. So the irony of all of this, and this like kind of signaling the way that education was shared, at least at the time when I was in hygiene school, was that we should be seen as colleagues. I'm the other licensed professional in the practice. And unfortunately, what I saw and what a lot of my contemporaries saw was that we still had to ask the doctor for permission. And so what happened over time is the number of times that I would see a patient and tell the patient we needed to do perio treatment, and then the doctor would say, I think it's okay. Why don't you go ahead and do that prophy, and then we'll recheck it later on. So my clinical acumen, my skills, what I knew to be true, was now being questioned by the patient sitting in the chair who I just spent 45 minutes with talking about the concerns I saw in their mouth. And even things like when I would try to tee the doctor up for treatment, and I would say, I'm seeing a, fracture over here, or this ally looks weird over here. And the doctor would say, no, that looks just fine. We'll just keep watching it, which is a really terrific way of saying we're just going to wait until it gets worse before we actually do something about it. That we didn't have a really great way of calibrating the language, the vernacular around how my doctor could say, thank you, Katrina, for pointing that out. We're going to continue to actively monitor this because this is a concern, and there are preventive things that we can do. Like if that's a broken alloy, let's talk about a bruxism guard. Or if you have stains in the occlusal surface of your back molars, let's talk about a fluoride releasing sealant. I don't know. That there were things that we could do, that we could talk over the patient and come together on. No, it was just yes or no. And I spent almost now 2 decades of my career time where now, like a pendulum, we've shifted to the other side. Now it's like these new grads are coming out with zero experience, but being told you can ask for this amount of money and the doctor will pay for it. And so I think there's an interesting piece here that I don't know if many are talking about, which is there's a subset of us hygiene clinicians out there, and I am one of them. And I'll just be honest. I'll say I work with AZPerio. I say I work with. I don't work for. I work with AZPerio, and I work alongside my doctors. I don't work for them. I work with them. My doctors are the best in the whole wide world because they respect hygienists. They respect our opinion. Every year we get an email around October time because that's Dental Hygiene Appreciation Month. And we are literally told, what is on your wish list? What equipment do you need? What new scalers do you need? What new ultrasonic tips do you need? What things have you learned about at CE coursework that you would like to implement? We participate in quality assurance calls with our doctors where we actually sit down and we say, hey, like we saw this case and it didn't respond favorably, and we want to be a part of the conversation about why that didn't occur. And this is what's so amazing. I make significantly less per hour than probably what these new grads are asking for. Because there's a subset of hygiene clinicians out there who don't necessarily want to make the most amount of money. We want to be in practices where the package is, we respect you, we respect your opinion, we recognize that you need the appropriate equipment to do the job that you've been hired to do. we want you to be a stakeholder in the practice. We want you to be a part of patient outcomes. We want you to feel respected. We want to support you when you take continuing dental education credits. And so I think there's an opportunity for us to kind of pull that pendulum back. JB, you had mentioned that we're starting to see an increase in hygiene school graduates, which is really wonderful. And that's an important piece. My fear is with some of these states getting creative with attempting to find a fix to a problem, what's happening is they're not necessarily creating a solution, they're creating a shortcut. They're bringing undertrained, non-licensed individuals in to perform treatment that, as a dental hygienist, I went through multiple years, coursework, boards examinations, and continue to maintain a license via CE in order to be able to do. So I think the important piece in all of this for us in dentistry is to look at where this pendulum moves now. How can we create an opportunity where the voices of doctors and practice owners who respect that this is a colleagueship, this isn't a I own the practice and you're going to do what I say, but rather I want to bring team members with me, because the team members that want to share their opinions and want to be a part of, ordering products on formularies and talking about protocols and renovating those things, those are driven individuals. That's drive. That's gumption. That is an internal motivator that isn't always commensurate with an individual saying, I need the most amount of money in order to do this. And so I think there's an opportunity for us to move beyond generalizations and consider what that spread of hygienists are. I don't represent all hygienists, because there are prophy princesses out there that absolutely want to get paid 80 whatever dollars an hour, and all they want to do is show up and do whatever the office manager put on your Dentrix appointment book that day. They're not going to talk to the patients about anything outside of that because it's inconvenient. They don't want any interruption in their schedule. They're not going to take out the garbage. They're not going to refill the glove box when it's time. I don't represent those hygienists, and respectfully, I don't know why those individuals continue to show up inside a dentistry, with the exception of they're getting an incredible salary for, in many cases, an associate's degree. And I know I'm going to get haters in my DMs on Instagram for saying that. I know. But the reality is, like, we're talking about treating human beings.
Yeah.
Right? We have to change that narrative. Okay. Thank you for letting me
We
get.
really do.
Everything you
Nothing,
said,
Jeff. Literally
Point-
nothing.
point
Can you
counterpoint.
just use your computer, Mike?
So
Just throw it out the window.
Get
So-
rid of it.
So I loved everything that you said. And, I think that our practice, I was raised, and JB and I are close to the same age.
We are not close. There's at least 4 years in between us, and that makes me young.
At this age, we're close. But, the thing is I was raised in a practice where, we've seen all these different practice models. The practice model that I was raised in, that I was comfortable in, and that the majority of my patients are comfortable in, is that when they come in, they go through hygiene first.
Mhm.
Okay. So that's their first encounter with the practice. They are ambassadors for our practice. And, I would say this to all three of the hygienists that work on our team, that boy, they can drive me nuts, but they are really the center of our practice, and we do co-diagnose. I loved what you said. You taught me something when you were talking about, because I feel that sometimes, like, some of them have come from really money-driven practices where it's like, oh, I noticed a crack on tooth number 18, and I'll look at the crack and I'm like, I'm not going to put a crown on a craze line,
Right.
and
Where
so
they're like
I've
97 years old, and you're like,
gotten to the point where I'm
I'm
like,
gonna
hey,
roll the dice here.
Yeah.
I'm like, great eye.
Yeah.
I think we should take note of that. I appreciate you pointing it out, but I think at this point in time, we're just going to keep an eye on it and see how it goes. And I actually, I also found that when I introduce new things to the practice, that they're so passionate about what they do, like AI. It's like, well, AI says there's a MO on number 30. We got to fill it. And I'm like, hey, it's okay for me to disagree with AI.
Right.
I see it, but when I turn AI off, I don't see it. I don't see it at all. So I'm going to respectfully say, let's take another bite wing of this in 6 months and let's monitor it. And at the time, I feel that you're winning them over. But the
Yes.
most important person in the practice is that person in the chair, and you're
Yeah.
winning them over. They don't want to hear, oh, let's go do a filling on tooth number 30. Let's go ahead and wait on it. So you've got to kind of explain your why all the time. But I think that there are
Oh,
so
Jeff,
many
I can
people.
hear you.
Jeff, we can hear you. Yeah, you might
Say
as well start.
something, Jeff.
Jeff, say something. Speak.
No,
Jeff,
no, not
speak.
from that mic. Use your words.
Hello.
He's there. Yeah. But no, I think that in dentistry, we need to have a big shift, because there's a lot of push for money-driven dentistry.
Yeah.
And granted, we all need to make a living. We all want to live in a nice house. We want to be able to support our family. We want to go eat nice meals. We want to put food on the table. All of the above. Yeah, we all want that. But when we focus on the patient and what's best for the patient realizes that, the patient shares that, and the money comes afterwards. It's
Always.
two
Always
different
works itself
mindsets.
out.
Always.
I wish that more people could realize that, because it's not all about the cheapest products to make the most money. It's about
Yeah.
taking care of the patient.
That's
And
right.
if the patient realizes that we're working together as a team to take care of them, it's all going to work out and we're going to be just fine.
And I feel like we're putting all the blame.
Excuse me, would you like to go ahead and introduce yourself, sir?
Yeah. Who
Yeah,
are
you
you?
don't know who you are.
I'm Dr. Jeff Horowitz, former mute.
Yeah. Go ahead, Jeff. Sorry, we're putting all the blame. I'll let you pick up where you left off.
No. The question that I had is this: is why are we putting all the blame on the hygienists that are coming? I feel like we're suggesting that there's all these hygienists. I feel like most hygienists that come out of school are really motivated. They're really excited to get into their career, right? And I think the workforce is as much to blame for this situation,
Yeah.
because
Yes.
how can a few of us say to the hygienist, well, the money is not the most important thing. Let's do the right thing by the patient. Let's really learn the science. Let's be the masters of what we do and be the people that the public is really seeking out. And then at that point, we might be able to command a reasonable salary. The problem is that they're also coming into this environment where so much of it is owned corporately.
Yes.
And they're hearing this message right when they get out that says, well, we're going to expect you to see this many patients a day. You're only going to get this much time to do it. We're only going to give you this much money to spend on CE. So here's the deal. Why would they not resort to saying, you know what, this is just a money game, so I might as well ask for what money I can? So I really think the profession is as much to blame as anything. I don't even know that it's a generational thing. I think, everybody kind of comes, or I can't say everyone. Most people come out of school with ambition and drive
Yes.
and excitement to do something really great. And I think our current workforce situation in dentistry is really a downer when a lot of people come out and see the reality of what this corporate business side of dentistry looks like versus the practitioner like JB, like Chad, like the periodontist that you're working with. It's just, we're really the exception in today's environment.
I agree. And I think that's the piece that is so hard for me. I have the amazing opportunity of traveling and speaking. And in fact, I spend the vast majority of my time traveling and speaking. And when I'm in the speaker ready room with folks like you, and you believe in hygienists and you recognize do the right thing and the production follows, and you recognize that there's never one generalization. New grads that are fresh out of hygiene school that don't fully know how to diagnose. My goodness, I teach coursework on AAP staging and grading, and I have people sitting in my room who and I'm going to be provocative again and say they are the proverbial old dogs who refuse to be taught a new trick. And so I speak with a lot of doctors that are like, I have this hygienist in my practice. He or she has been practicing for 35 years. They really need to retire, but all my patients really like them. They do prophies on 6, 7, 8 millimeter probe. I mean, so we see both across the board, right? It's not, oh,
Yeah.
because I've been practicing for this long, you know that you're going to get somebody who knows how to diagnose and will diagnose appropriately. In unfortunately a significant portion of cases, if you've been practicing for X amount of time, you've almost lost that edge, that bite, that excitement, that ambition, that fire, that passion, that drive that you had when you graduated fresh out of dental or dental hygiene school. And so part of the challenge for me is I have the amazing opportunity of working with periodontists who believe that hygienists are an integral part to the dental wellness system. I also get to travel and work with speakers like all of you who believe that hygienists are an important piece to that puzzle. So when I am speaking in Kentucky, Tennessee, Pennsylvania, Seattle. And I have hygienists come up to me and they say, you don't understand, Katrina, my doctor only gives me 35 minutes to do a full hygiene appointment. And I'm not allowed to order new instruments. And I paid my own way to come here to this course. And how do I tell my doctor? How do I explain to my doctor that I need more time to do this? I tell my doctor, I think this is perio. I think we need to do SRPs. And my doctor tells me, no, it's fine. Just do the prophy. I mean, I see the other side of this where hygienists are not respected, they're not nourished. The thought that the three of you have about respecting hygienists and making this a team collaboration is not as common as I think we all would hope it to be. And so the work that you do here with Dentists in the Know is so important. I hope that your colleagues are listening and hearing about how important that is. I will also say, don't let one bad egg ruin the bunch.
Yeah.
Don't let one hygienist who, burned you all of a sudden change your perception or views of bringing a mid-level provider in who can help support the health outcomes of your patients. Because it is important. It is a valuable asset to have a highly trained and highly skilled clinician in your practice who can talk that talk and tee up you for success. So when you come in for that exam, that your hygienist has prepared the patient start to finish on what those treatment needs are.
I'll be salacious.
Yeah.
Oh, okay.
Mm.
May I?
Please
Yes.
do.
I mean,
Are you going to be
evidence and
provocative?
point. Evidence
Be
and
provocative.
point. I posted a story this week about Delta Dental, California. Normally, when I post something that's a little edgy, the comments will be equally as edgy. Like, some love me, some want to hit me in the face. Like, it's a whole gamut of stuff. Not one negative comment towards me. Why? Not because me, because everyone is collectively in agreement that the insurance company and the structure of reimbursement is largely a part of a significant part of the problem between the healthcare providers, their team, and the patients. And if you removed Delta Dental or MetLife or Blue Cross and Blue Shield from the equation and just billed a reasonable fee, compensated your people reasonably, supported a culture of co-diagnosis and preventative care and treatment, and the patient was willing to part with their money in appreciation for that particular service, we wouldn't even be having this conversation. But like you said, Delta Dental and all the other myriads of insurance companies haven't increased their fees one iota. And in many of the comments that were posted this week, some practitioners are experiencing a 20 to 30% cut in their reimbursement rates. So that's a sizable impact to their revenue generation stream that then becomes the real nuts and bolts of a practice, to the point that you're like, can I pay rent, my hygiene salary, my dental assistant salary, my admin team, and still treat patients this month? And for the first time, not woe is me dentist, but for the first time, we're seeing the downturn of dental dentist's salary. So they're taking it as a response to say, I still have to keep the lights on. I still have to pay the team. I recognize that we have to continue to provide these services, but my cut is going to keep coming down as the reimbursement rates change. So this is not a for or against hygiene or dentists. This is actually an anti-insurance statement that I think that has played a very large part of it's probably corporate dentistry and insurance reimbursement structures that have really actually created a divide between cultures that were otherwise really working quite well together 25, 30 years ago, because that really wasn't part of the problem. It was a very different time in dentistry and in medicine in general. So
in the 1970s, the annual max from
the same.
insurance was $1,000,
Yeah.
which is
We
what
ain't
it is
changed.
today. Conversely, I just looked it up. The net worth of the CEO of Delta Dental is $15 million.
No, that's California. That's only California.
Right.
I just posted this.
Yeah.
Her annual salary,
Her annual salary is what?
$15 million.
Yeah.
Okay.
That's annual salary, not
Yeah.
worth.
That okay. So her annual salary.
Right.
Like
Yeah. No, I know.
I-
It's a
so-
nonprofit.
So here's, I think, the challenge. So we have to find an answer. And I think the challenge is the more that we see private equity involvement in dentistry, the more that we see, equity companies, acquiring, smaller private practices, because that looks like the best exit strategy and the best, more lucrative buyout. The more that we remove the providers from the decision making,
100%.
start to finish, right? Like
All of us,
practice owners, hygienists, what we see with hygienists is a symptom of a bigger challenge.
Correct.
And yet you look at the supplement industry and the preventive or wellness industry, and it is multi-billion. Right? People will sit on TikTok and buy a supplement that helps them poop faster or whatever, because they see that there's value in that.
You have that link, by the way?
I do. Happy to send it to you when we're done here. Yeah.
Asking for a friend.
Let's take this
For your
offline,
friend,
okay?
for your friend, right? Not for you.
Yeah.
Yeah, I get it. But the idea being, like, I think the other side of this is acknowledging that for so long we've been pinned against the patient by the third party payer. I think a lot of times patients think, if my insurance doesn't pay for this, it's because you thought we needed to do something that didn't need to be done. Not the standards have changed, where now folks who make the decision about paying or denying a claim make bonuses
Correct.
off of the number of claims that they deny. And we can talk about dentistry all day long, and I think dentistry is really important to this, but I also see families, parents who are not able to get their health insurance to pay for their children to receive life-saving aid for
Absolutely.
whatever they have going on, which is a very strange thing. And I don't mean to get political, but a very strange thing for, like, being in the land of the free, and like the amount of wealth that we have here in the United States, that, like, we are some of the sickest people around the world, because we just are so scared to receive preventive health care based on those costs. We recognize how important dentistry is to the full picture of general health. And we recognize how, from a cost perspective, how insignificant something like a fluoride treatment or sealants are when you think about the cost of what happens if we don't actively treat this disease.
Right.
So I think our opportunity to find a solution and find something that works, that is compelling, something that helps our patients understand that what we're here to do is healthcare. Dentistry is a for-profit profession. It's a for-profit industry. Like, our practice owners should be walking away with a profit at the end of the day. But
And none of us make $15 million a
to the
year.
tune of
Yeah.
$15 million a year. So
No.
the idea being it has to be reasonable. And unfortunately, again, like a pendulum, we have swung too far to the other side. I think we have the opportunity now to educate our patients and help them understand that what we're doing, and Dr. Duplantis, you said it beautifully right out the gate when you said you do the right thing, the money follows. Educating our patients and helping them understand what we're doing here and why it's so vital, not just to their oral health, but also their systemic health is so important. Hygienists are key players in that conversation, in the assessments and the diagnostics and the planning and the implementation and the evaluation of those pieces. And I think if we can, to your point, JB, acknowledge that this is not us against each other, but rather the fact that the industry itself has kind of spiraled into a locus of disarray and out of control when it comes to how third-party payers are creating such a strong dictation of how this shows up inside of our clinical practices day to day, that if we
It's
can acknowledge
interesting
that,
how
we
it
can come together.
Yeah, it's interesting how it came back in that direction, because when I made the comments about a lot of corporate and private equity ownership creating that environment, for financial gain, that we have to make the appointment shorter, we have to do it with less equipment, we have to figure out a way to make it more profitable. When JB made her comments and then you spoke after, it really kind of resonated with me that why did corporate dentistry have the opportunity that it did to overtake so much of dentistry? And it's because it became so much less profitable for the average dentist who is just trying to do the right thing. So, I really do think at the end of this food chain, it really does boil down to these third party payers that, even though I was trying to say that I think corporate dentistry was part of the problem, really, why did corporate dentistry get so far into our profession? And it's because of the third party payers making it less profitable for all of us. So,
Damn
um,
it.
yeah.
And Jeff was alive when the heyday was happening.
Oh
He
Yeah.
saw
man,
it.
what was that like?
He
You were
saw it
probably
It
100%.
It was like the Wolf of Wall Street. They're
It
just like throwing money
was.
everywhere.
Yeah.
I want 4 martinis before lunch. Let's go. He's just having a great time.
All
There
right.
literally was a time where people were knocking on our door going, give me a new grill. I don't care
Let's
what it
go.
costs.
Veneer, all
Yeah.
the things.
Let's
Yep.
do this.
Yeah.
Dare to
Um,
Been
dream.
nice.
Okay, Katrina, you've been on here almost an hour.
Yeah.
And I've yet to hear one perio gem. So we've addressed all the world's problems. I think probably the federal government will be calling us pretty soon
Yeah.
to a roundtable. I feel very confident about that.
Okay. Let's
Okay.
do it.
In the
yeah,
meantime,
my insurance was just canceled on my phone.
yeah, I'm pretty sure the FTC is going to hit us with a antitrust. What is it?
They just won't let me be.
Damn it, what is the term? Anyway, I'll think of it, because a lot of people on the comment section when I posted that, they're like, we should all just band together. And I was like, let's just look at the FTC rules. Like, we can't be talking collusion. No collusion. We
Yeah,
don't
no
collude on this podcast.
No.
Federal Trade Commission.
That isn't what you saw there.
That is not what you heard or saw.
No.
Anyway, I would just love maybe 3 current trends in perio products, maybe, or treatment modalities, or something that you're like, this is this is going to be how we do it in 10 years. Like, no more Cavitrons, only air polishers, like whatever it happens to be. I want to hear 3 or 4 updates, because I think people love that. And especially for dentists, we don't get enough perio education. So bring it on.
Yeah. Okay. So let's throw it down. We'll do like a quick and dirty.
Yeah. Let's talk calculus.
Well, let's talk calculus. First thing I think is really important. We're going to continue to see trends linking periodontal disease to systemic disease. We're going to continue to see specific bugs that are, identified in different kinds of systemic ailments. current statistics indicate there are about 57 unique diseases and conditions that have a biological plausibility linked back to periodontal disease. And I think we're going to continue to unpack more and more of those conditions. And so as we start to create that little like connective tissue, see what I did there?
Oh,
As we create that connective tissue, I think the role of not just salivary diagnostics, but specifically crevicular fluid diagnostics. So actually not just like spitting into a tube, but actually going into those deep pockets and getting that gram-negative anaerobic bacteria and genoming it will be really important. I think that will be like a lab report that dentistry will be responsible for collecting, quite in the same way that when I was a geriatric pregnant person, my doctor would get all of this lab work to make sure that, you know, everything was healthy and on target, right?
Geriatricness was good.
My geriatricness was continuing to remain geriatric. Okay, so this is like so crazy. I saw a maternal specialist because geriatric, and they gave me an envelope on my like first appointment with them, and the first sheet in the envelope when you opened it up literally said, "Am I too old to be pregnant?" Are you kidding me?
Honey, that ship sailed.
I know. Yeah. I was like, we're already there.
Yeah. Now's not the time to be considering that.
I know. I know. I'm a geriatric pregnant. So I think that will be, it's huge right now, but I think that's going to continue to emulsify. Alongside that, we're going to start to see biomarkers, so inflammatory markers being tested. In our practice at AZPerio, all of our hygienists and assistants are phlebotomy certified. We do venipuncture, so we can do PRP and PRF for our doctors, which is super cool. And I think we're going to also start collecting that blood work and start using it to gather inflammatory markers, C-reactive proteins, interleukins, tumor necrosis, like all of those good guys. They're not actually good guys, they're bad guys. No. Sorry. Those inflammatory cytokines. I think we're going to start to use that as like okay, so here's where you are now. We're going to go ahead and reduce that bioburden. We're going to reduce that inflammatory load, and then we're going to test you again and see where your inflammatory markers are. Quite akin to what our healthcare colleagues are doing in the healthcare space, right?
Yep.
So I think that'll be really big. When it comes to products, things that I think are really beneficial and transforming the way that we provide care to our patients, air polishers are just on the tip of everybody's tongue right now. Super and subgingival air polishing is so different from when I graduated from hygiene school, and the only thing we had available was sodium bicarbonate. Now we've got glycine, erythritol powders down to like 14 microns. I was in the very first cohort of hygienists that went up to Chicago to learn on the very first supra and subgingival air polishing system that made its way into the United States. And I had to listen to this 3-hour lecture from some guy who has a PhD in powders talk about powders. It was like the biggest snooze fest of my life. But what came out of that lecture was really an appreciation for not just the powder itself, but the design of the powder, the fact that it's a sugar alcohol, the fact that it's really providing terrific medicament and debridement benefits for our patients. So now it's allowing us to be far more effective and precise in our biofilm debridement. The final piece that I'm going to throw down, and this is a really like profound passion project of mine, is studying the oral microbiome. And I will say, like when I was in hygiene school, I loved microbiology. I was a big microbiome nerd. But we've learned about the microbiome when it comes to the gut, right? You give your patient a script of clindamycin and it just like cleans them out, right? We know that clindamycin is quite notorious for that. And we also understand that the gut has a very delicate microbiome. You wipe everything out, you are not only destroying the diseased producing bacteria, but also the health producing bacteria in the gut. And a significant portion of the immune system arises from the gut, 70 to 80%, depending on what article you're reading today. We also understand that the oral microbiome is really important as well. And so studying that delicate balance has been really important because for so long we've been taught to give our patients chemotherapeutics that wipe everything out. And when I graduated from hygiene school, that was chlorhexidine. That was like the queen bee of if you wanted to get rid of something, you just give them that broad spectrum antimicrobial. We now understand that the oral microbiome is very delicate. And so we're starting to study the use of health producing oral probiotics and the role that oral probiotics play in creating that delicate balance. And Probiotics are very strain specific. So each strain of bacteria that's in a probiotic is kind of like a breed of dog, right? So you want to make sure that you have the right strain for the oral cavity. And so we've been going back and forth on this. We've been studying it a lot in the perio space. We've come back. The consensus papers have now said that there's really only one bacteria that we know compellingly will help to address periodontal conditions, and that is a bacteria called Lactobacillus rhodori. So we know that probiotics that contain L. rhodori in it, we in our practice use BioGaia. Because that ProDentis line has 2 gorgeous strains of Lactobacillus rhodori, is really important. As a new mom, I've been obsessed with the microbiome. Before the baby was even born, we were harvesting colostrum. We were even just getting like small little vials of it. Breastfeeding, I was taking probiotics like pregnancy probiotics. The baby takes probiotics now because I want to colonize his mouth and colonize his gut with these probiotics. What we're starting to understand is so critical when it comes to the oral, and of course, by the way, the mouth is connected to the gut. So the oral gut axis. We're starting to understand that if we can actually put healthy bacteria back into the mouth and the gut, we can actually help to stave off a significant portion of disease. Yeah. So that was my TED Talk on the new trends in perio.
Thank you for
that question. That was amazing. Thank you for attending. But cool stuff that I think changes.
Yeah.
To your point, like just scrape it all off, use an ultrasonic. Like there are so many things that we're doing now to really become involved in oral wellness for our patients.
I think that there are so many takeaways from tonight that we didn't really even get to dive into what we were going to talk about, but we said, let's just let it go where it goes.
Yeah.
And
Yeah.
it just went.
Yeah.
So I am going to.
It just means we can have her back and we go further.
Oh yeah. There's going to be more.
These are solvable problems, right?
That's right.
These are solvable problems.
You know where we need to have.
There was good chemistry and good microbiology. Would we all agree?
Yes.
Yeah. Okay. All right. So, hey, first of all, thank you so much for being here, Katrina. You were just fantastic. It is always good to catch up with you. Next time we might need to get your sister on and talk about the foot biome. Yeah.
Let's do that. Yeah. Like a sister talk. That'd be cool.
Let's just have like teeth and feet. But anyhow, one of the things that I want to close with is this. We went on. Sorry, my breed of
Your
dogs.
Are they hungry? Is it supper time?
They don't like Love Island either.
Yeah.
One of them's kind of getting to the end of the rope, and I think he's a little senile. But anyhow, thank you, Parker. He was blessing us with his presence. So anyhow, what I wanted to say is that we went on this awesome tangent that I didn't really expect to go on, where we really talked about the profession of hygiene as a whole, kind of where it's at, where it's headed, where all of our opinions are. But there's one thought that I just kind of want to leave with everybody, is that you stated that you have a hygienist that comes up to you at a meeting that says, hey, my boss won't pay for this CE. I'm here on my own dime. I'm trying to learn. I want to do this. I want to do that. My hands are a little bit tied. Money's tight. There's probably a bunch of things that you get. If we step back and look at everything as a whole, I think your answer to that hygienist is, hey, guess what? Unless you're in like freaking Denmark, South Carolina, there's another job for you where somebody will respect your worth and allow you to showcase your skills and really improve the lives of patients. We're at a wonderful crossroads in dentistry from that perspective. Maybe not from the dentist perspective, but from a hygienist perspective. If you know your stuff, if you love your stuff, and if you're passionate about patient-centric care, there's an opportunity out there for you. I promise you that. So maybe that's the answer you come back with, rather than, oh, well, let me tell you how to come. Not teasing. I know you wouldn't do that. But just say, hey, learn as much as you can, because there's somebody that's going to need that. And they're out there, and it's a great opportunity for hygienists. And so we appreciate you all. We are hygiene-centered practices, so we truly appreciate it. And thank you very much for what you do for our profession. Thank you for your knowledge. And we will have you back for
Thank you.
sure.
I'd be honored. Thank you for loving hygienists. We really appreciate it.
And we need to have her in November.
I think she said October, Jeff.
Huh?
Oh, November. Yeah, I'm like.
No, we have an event in November.
Yeah. Okay.
Oh, okay.
Right.
Cool.
Right.
Let's do it. Let's have your people
Yeah.
talk to my people.
Yes.
Will do.
Yes. Sounds like a plan.
Enjoy your brute.
Thank you very much.
Enjoy your brute and enjoy your
Cheers, you
baby.
fabulous
Cheers,
friends.
everyone.
I appreciate you.
Good night,
Cheers.
everybody.
Have a
Love
great
you. Thank
night.